Okay, our next speaker, I met this man earlier today. He's got a lot of interesting stories, a lot of interesting experiences. He's a letter carrier from Duluth, Minnesota, and he's also an aortic aneurysm survivor. Please welcome Mike Sylvester.
Thank you, and thank you, Amy and Pete, for putting on this amazing event again. I'm just going to briefly summarize my health issues because I could probably spend 2 hours talking about them. I've told my story a couple of times here at Rock from the Heart. Some of my health issues include heart attack, ascending and descending aneurysms, ascending and descending dissections, heart valve disease, atrial fibrillation, stroke, and then the stroke gave me epilepsy. And yet here I am. After telling my story at Rock from the Heart 2 years ago, I was approached by the Alliance for Aging Research and asked to take part in their patient advocacy training. Because of COVID, we had to hold it virtually, and I completed that and was then looking for projects to work on in my spare time. So I worked with the Alliance for Aging Research, which is a large nonprofit dedicated to helping people live happier, healthier lives through the advancement of technology. So I did videos and podcasts with them. And then I also worked in conjunction with my healthcare provider in Duluth, Essentia Health. I did TV commercials, there were billboards, there were direct mailings. And I think a lot of my goals align with Rock from the Heart. There's diagnosis, there's treatment, and then there's recovery. And I've been through all three of those on a couple of different occasions, 6 heart and vascular surgeries in the last 6 years. And I think there's also another component, and you heard Karen talk about it earlier, and that's being proactive. So a lot of what I've been doing is centered on helping people become proactive. After having my first open heart surgery, they said, well, you're going to meet with your general practitioner every year. And who is that? And I said, don't know, don't have a doctor, don't go to the doctor. They said, well, that's going to change, and it did for me. And so I try to get the word out to people. Please go to the doctor, have them check your cholesterol, have them check your blood pressure, and have them listen to your heart. Those 3 things can make a huge difference. And so I've really been trying to focus on helping people manage those risk factors, because you can save yourself a whole lot of pain and suffering along the way if you just go to the doctor and have them do those 3 simple things. And I also am alive today because of a patient advocate. Following my open heart surgery, or my first surgery, which was for a heart attack and having a stent put in, I was in the post-anesthesia care unit, and I was sweating, and I was vomiting, and I was complaining of chest pain, and they thought it was just the anesthesia wearing off. And an echocardiogram technician took a look at the echocardiogram and said, this doesn't seem right, there's something going on here. And she physically went and got the cardiologist, and the cardiologist came in, took a look and saw that I had aortic valve regurgitation, looked at my symptoms, and I asked him later, and he said, well, you had all the classic signs of an aortic dissection, and he got me in for a 10, 11-hour surgery that I barely survived, and I've had 5 more since then. So because the one person took a few minutes to go get somebody to say, let's take another look at this, that's the reason I'm alive. So I've made it my goal to get the right information to the right people so that they're in the right place at the right time to make the right decisions. Because I think for a lot of us here, that can really be the difference between life and death. Thank you, everyone.